My name is Howard Mann, and I would like to welcome you to a brief discussion on value-based purchasing. This is the first part of a three-part podcast on value-based purchasing, value analysis, and hopefully combining the two together to meet some of the requirements of CQO. What I'm going to talk about is what is value-based purchasing in this first part. So what is value-based purchasing? Well, it's part of the 2010 Patient Protection and Affordable Care Act. In general, it's the Medicare's ability to purchase bulk services from providers, including clinical services, beginning 3 days prior to inpatient admission through 30 days after discharge. The provider is responsible for all the services, including physician services and post-discharge services like rehab. Once services are complete, the provider receives compensation from Medicare based on their quality of care. This would include the DRG payment, plus or minus a total performance score, which is subject to the minimum case and measurement requirements of the services provided. Hospitals that don't meet those requirements are paid by the DRG in the corresponding fiscal year and would not receive an incentive payment, nor would they be penalized. For every measure, hospital receives improvement of achievement score, whichever is higher. Value-based purchasing is measured by 24 metrics in 4 categories. Those categories are patient satisfaction, clinical process of care, efficiency, and outcomes, which, if you notice, matches our CQO. Patient satisfaction itself includes HCAHPS scores and the patient event. Clinical care includes mortality or 30 days post-discharge for things like heart failure, AMI, or pneumonia, and includes patient safety indicators such as elective delivery, CLABSI, surgical site infection, MRSA, and other indicators. Efficiency includes the cost of care, which hopefully increases transparency to the consumer, and risk-adjusted and price-standardized claims data that creates measures for both Part A and Part B services under Medicare. Outcomes incorporates services provided during the post-discharge 30 days. Financial impact on hospitals based on DRG payments and scores. CMS will withhold 1.75% of the total performance score. The highest performer receives a net change in payment of 3% minus the 1.75%, or a 1.25% increase, so they are rewarded. The worst performer receives a maximum reduction of the 1.75% and does not receive any incentive payment, so they actually incur a 1.75% loss. About half of the hospitals are predicted to see a very small change in their DRG payments. Could be a minus 0.4% to a plus 0.4%. So in general, that's value-based purchasing. The next segment in our presentation will be on value analysis.